In his first State of the City address, London Mayor Josh Morgan announced a massive anonymous donation of $25 million to help fight homelessness. It's enabled a new approach to confronting an urgent problem, one where he said, quote, delays are not measured in days, they're ultimately measured in deaths. Josh Morgan was elected just this past October after 2 terms as a city councillor and joins us now on how his city hopes to make real progress for unhoused people in the community. Welcome, Your Worship. Welcome back, I should say.
Thank you. I'm happy to be back.
Before you were
It was
here?
a bit of a time period between visits, but
When were you here last?
it was like 2015. I was here talking about ranked ballots because our city was one of the first to implement ranked ballots across Canada. Now that's since been taken away, but had a great conversation about that at the time. Yeah,
Okay,
it's
and
nice
now
to be
you're back as mayor.
Absolutely. Yeah.
And your city is doing something remarkable. I just want to break down what it is that's happening in London right now. Your City of London's plan to combat homelessness, it's titled London's Health and Homelessness Whole of Community System Response. The plan centers around building 24/7 integrated shelter hubs, starting with 5 and eventually 12 to 15 in total. Each hub can service between 25 to 30 people. The goal is for the hubs to be low barrier. Intake and outreach will involve a coordinated multi-agency effort. The hubs will provide access to private and congregate spaces, basic needs such as food, showers and laundry facilities, acute and primary care, as well as housing and income supports. In addition, London wants to construct 100 high support housing units in the short term with 600 units erected over the next 3 years. Some people may say this is very ambitious. How would you describe it?
I would say it's needed. So it may be ambitious, but it's absolutely what our city needs. And if you think about how we built this system, it was hundreds of individuals who ranged from those in our hospital system, those on the frontline services, those in general health care, those in our development and business community, as well as our city staff, all coming together through a series of summits representing over 70 organizations saying, this is how we need to transform our system. So although it is ambitious, it is absolutely positively needed, and that comes from the voices of those who know this space the best.
Walk us through what this system response might look like in real life. How does an unhoused person in London go from being on the streets to having their needs met?
Yeah, so the system response is really about meeting people where they are. So having a low barrier hub allows people to come into a space, get some basic services they might need. It might just be laundry or a shower or food or shelter from the warmth. And then they can leave that if they need to. But contained within that hub is actually a range of services that when they choose to take it to the next step, to tackle an addiction or deal with a mental health issue or look for more permanent housing and stable housing, those services are integrated in the hub and we can roll people into the needed services and ultimately into housing with the proper supports. So whereas we had all of these services available in our city before, what we've really designed is a system and pathways through that system from being on the streets into the type of housing that will support that individual to be successful in their housing journey.
So right now, people can access those services separately, not together.
Yeah, I wouldn't call it integrated at all. And what we have is a lack of coordination between the services. So the hubs provide the ability for those services to go. The other thing we don't have is a one point of contact. So what we're designing with the system is there will be one point of contact, one point of referral that everybody will be using. Everybody will know, whether that's a business who sees someone who needs help or an agency who has someone come in their door and doesn't know where to send them. The hub system will be a fully integrated system that is cross-coordinated through all the agencies so that there's no wrong door to show up to first.
Right, so the people that need the care know exactly where to go.
Yeah, and we've never had that before in our city. There's been a lot of cross-collaboration. In some cases, we've had agencies working in complete silos, unaware of what others are doing. But we have everybody speaking with one voice at this time and everybody on the same page for where we need to go next, which means there are some organizations that will have to transform how they do things over time. And everybody is committed to the cause, to meeting the challenge, to helping the most vulnerable in our city, and that means they're willing to do things differently, which I think is both transformative as well as very brave. For you to say, I'm willing to change my organization to meet the need, I think is an incredible thing.
And at the heart of this, obviously, is lack of housing. We all know that housing has become extremely unaffordable for everybody right across the board. The province and the country itself hasn't really been building social housing. Your aim is to build 600 high support housing units, a bold goal. What makes your plan feasible?
Yeah, so there's a couple of things that make our plan feasible. One is we're speaking with one voice now, and we know how we want to integrate this. And I would say there's a couple of things we have going in our favor. First is, as you mentioned off the top, the very generous private contributions from an anonymous donor to start us off at 25 million and another 5 million of matching, which means, we essentially have the capacity here to start from the private sector at $35 million. We then have existing programs at the federal level on the housing side, whether that's Rapid Housing Initiative or the New Housing Accelerator Fund, or the various investments that our council has made over the years. In our last multi-year budget, we invested tens of millions of dollars into the housing space. So we can bring that focus and that money under this banner. And I would also be remiss if I didn't credit the provincial government in their budget yesterday in putting money into mental health and addictions, putting money into homelessness prevention, all of which will support the type of system that we want to build. So what we have is, I think, a lot of things going in our favor, which makes the ambition of the system a little more realistic when you look at that it is truly a whole of community and ideally whole of government, with all governments pulling in the same direction approach.
You mentioned the budget. I will come back to that in a few moments. But, everything, it sounds great. First of all, do you know who the anonymous donor is?
I do. I met with them many times, sat in their living room and talked about it. But I'm not going to tell you.
Okay,
Yeah.
I was going to ask.
Well, when you give $25 million, you get some.
I mean, it's so
anonymity.
incredibly generous, and it
know.
sounds fantastic. The idea sounds great.
Let me tell you what's so amazing about that donor. They gave the money not knowing the final version of what the system would look like. Like they see the problem as so significant and such a focus for our community to have to land on that they gave this money without exactly knowing how our hub system would be finalized and developed. They know now, they're very happy with it, but they had that huge amount of trust to give a significant portion of their personal wealth into a cause. And I think they did that because they believed in the people at the table. And I want to say something for a moment about those people at the table. Not just healthcare workers, not just businesses, not just the city, but those frontline agencies, people who have been in this space for decades, almost their whole lives, some of them, who have seen people that they've served suffer and die. The donors know that these people in this space know where we have to go, and they believe in them so much that they gave this money without really knowing where it landed, because this is what the system was designed by. It was that collaboration of all of those partners together.
Well, you mentioned frontline workers, and the Forgotten 519, hashtag the Forgotten 519, is a group of frontline workers. They staged a hunger strike last year to bring attention to London's homeless community. Could London City Council have pushed this forward without their efforts and the advocacy of other organizations?
So I don't think so. I think that the work that they did to come together and to put pressure, not just on us, but the bringing together of the different agencies for the first time to start to talk, I think in this, the city was a bit of the bad guy. And sometimes you need a bad guy to bring people together, to have them sit beside each other, to talk about how their agencies can work together.
So when you say the city was a bit of a bad guy, do you mean that London should have done something better?
We were the focus of the protests, right? And what they were calling for is the system is broken, it needs to be transformed, and the city needs to provide some leadership in that. And so what we did was a couple of things coming out of that. One, we transformed our city-led winter response into a community-led winter response. This was the temporary response to deal with helping people through the winter and the cold. That actually caused us to start to work in a different way with agencies and agencies with each other that rolled into these health and homelessness summits where we brought hundreds of people together and dozens of agencies to get on the same page. So I think everything happens for a reason, and where we've landed now today is people who are outside of City Hall protesting are sitting at the table with us as part of the solution and helping us design this whole of community system.
It's one thing for community members like those frontline workers to go on a hunger strike to help their unhoused neighbors. But I think the number is over 200 people in London. Unhoused people have died since 2020 from sleeping on the streets. And ideally, you would want everyone to say this is a great idea, but the units that you're building have to go to a neighborhood. And we've all heard about the NIMBYs, the not in my neighborhood. So how will you navigate that sentiment from community members?
Yeah, so this is always a challenge that the cities face, whether it's high density or infill development, or whether it's placing critical services in neighborhoods. And I think what we have now is a very thoughtful approach. We have a governance structure that we're developing. We're going to do engagement with communities. And ultimately, the hub-based system is what will make things better. It's what will give people a place to go, take them off of the streets, stop sleeping in doorways, find the shelter, security, and support that they need at the time that they need it. And so, although the placement of the hubs might have some friction around them, ultimately the hubs are what is going to lead to the overall situation in our downtown, in our core, in our city as a whole, lead it to be better. And they will need to be spread out. We will need hubs in multiple locations. And those hubs will also have to be designed as we build them out with specific purposes. I could envision us needing a hub specifically for women or those who identify as women. I could see us absolutely needing an Indigenous-led response that is hub-based, and we would design that. Well, we wouldn't design it, actually. We're going to allow our local Indigenous communities to work alongside us and design their solution to the system. But we also need, things for people with significant mental health challenges, things for people who are young moms with young kids, and our YOU, Youth Opportunities Unlimited, is doing some amazing work in that space in our city. So what we have here is, yes, it could be, some friction as we place the hubs, but we're going to have known, responsible, really smart agency partners running and working in those hubs that I think people will hopefully embrace in their communities.
Your city also had so many great ideas coming from London. You had the HOME bus that would go to where it was needed, and people could access healthcare through the home bus.
Yeah.
But how would this plan reform existing procedures at places like hospitals? Because hospitals might be the places that unhoused people go to, but they might not always be where they feel the safest.
Yeah. Well, there's two places that people land when no one knows who to call, and that's the police and the emergency room. And I'm happy to say that both of those agencies were at the table, including the CEOs of both of our hospital systems, in the design of where we needed to get to. But there will be other things that happen within the healthcare system that will be able to support the work we're doing. When we look at the work that our EMS service is doing, and it's run by the County of Middlesex, and we have a great partnership with them, they're talking to the Provincial Health Ministry about, can we have more community paramedicine? Can we have more alternate drop-offs rather than just taking everybody who gets a call to the emergency room? Which, when we have a built-out hub system, will provide some of those alternate locations so that people who don't need to land in the emergency room and in the hospital system don't have to land there. People who would traditionally call the police for an emergency response, that may be referred into mental health workers or addiction support workers who could bring them and get them to a hub that has that integrated services there. So I think that there are strains on multiple parts of our system right now, but there's a response, this whole of community response we're working towards, has those players who have the strains on their system at the table, and they understand that what we're building will benefit their organizations in taking some of that pressure off both their services and their frontline workers.
Well, the will seems there to make this happen, but you are going to need money.
Yes.
How are you going to staff these hubs?
Yeah, so like I said at the start, we've got a number of pots that we can draw on, and we have an amazing, public donation campaign already going on that was kicked off by that very generous donor with the $25 million. We also have a number of other sources that, like I said, we have at the city. So when you think about both the hub-based system as well as the housing that goes with it, I would give the federal government credit for the tremendous amount of investments that they've made in housing through the Rapid Housing Initiative, now the Housing Accelerator Fund, and other avenues that we can draw from. And with the right flexibility in those programs, we can shift into a model to support the hub-based system. But as I said, we also made tremendous investments in our last multi-year budget, a decade-long investment into housing that we can now refocus and bring under what is a much more integrated model. So we have a lot of tools at the disposal for us to get started. Where we will need to continue to have conversations with the province, and I know we'll talk about their provincial budget, is the initial injection is great, but long-term healthcare dollars to support the wraparound service supports is critical to this being successful. This is a healthcare issue, right?
Why is this a healthcare issue? Because I think sometimes people might not be able to connect the dots of how the unhoused crisis is a health issue.
Yes, so they're connected. You can't have stable, secure housing if you have an addiction, if you have mental health challenges. Healthcare and healthcare resources allow for that stability in people's lives to be successful with their healthcare journey. And when you talk about the types of wraparound supports that you need to either break addiction or to have mental health supports, when you look at the work that organizations like Indwell and others are doing to provide those are healthcare-based services in a housed environment to help people be successful. Just building housing and throwing someone into it is in some cases setting people up for failure if they don't have the proper supports to be successful. When you've been living on the street for a period of time, there is a transition that has to happen sometimes and supports that you need to transition into stable long-term housing and the responsibilities that go with that. So that piece in between is absolutely critical, and that is healthcare dollars.
But this isn't just a feel-good initiative by the City of London. How does the city benefit by doing this?
Well, the city benefits in multiple ways. First and foremost, we're acting in response to a need. As we said, our delay in this is not measured by days, it's measured by deaths of citizens on our street, whether that's by cold, whether that's by addiction, or whether that's by anything else that could happen to them. So first and foremost, it benefits the city because it is our job to provide safety and security and opportunity for the citizens we represent. Second, there are a huge number of services that are overwhelmed that we fund as a city. That's the police service, we fund the land ambulance service in partnership with the county, and the hospital service, which is funded provincially, certainly has an impact on the residents of London. They are all very strained through this crisis. And so a reimagined, integrated whole of community approach that all of them had a part in designing is going to benefit the city tremendously.
You mentioned the budget earlier, and we asked a spokesperson for the Ministry of Municipal Affairs and Housing about whether the province is ready to support London with this plan. They sent us a statement via email on Friday, March 24th. Here's what they had to say.
Okay.
In 2022, the province launched the new Homelessness Prevention Program, HPP, and the City of London has been allocated $13,375,000, an increase of more than $850,000 from 2021 to 2022. In total, the City of London has been allocated approximately $23.5 million for housing and homelessness funding in 2022 to 2023. In addition, as we just announced in Budget 2023, the Ontario government is investing an additional $202 million annually in the homelessness prevention program, bringing Ontario's total yearly investment to close to $700 million. That's a lot of numbers.
Yeah, it is.
What's your response to that?
Well, my response to that is, let me start with the last thing you said, and that's the new needed investments that we've been advocating for. I've had conversations with Premier Ford, Health Minister Jones, Minister Tabolo, Minister Clark about the need for investments in mental health and addictions and homelessness prevention. And they have delivered on that in the budget. Yes, there have been investments before, but what we knew and what we've seen through COVID is the situation get worse. The demands on our system increase. The number of people on our streets go up. We know that COVID has illuminated great inequity in people's capacity to help themselves and be in a stably housed environment. We also have gone through an unprecedented time of cost and of cost increases, whether that's housing affordability or just simply the cost of living, of groceries, gas, fuel, all the things that people,
All the things.
people that you and I with kids know that things get more expensive. So the need has never been greater, which means the investment needs to be never greater. And
So
that's
is what the province offering enough?
I think it's an enormous start, right? And that what the province has put in our hands, and I'll have to wait to see the exact numbers as they flow down to our city, because you talk about province-wide numbers of 200 million and 400 million in different envelopes. What we have in our city, we're pretty confident that this gets us started. The money that they put in front of us allows us to open hubs, allows us to move people into those spaces, allows us to start building the housing that will support those hubs in partnership with others like the federal government. So. Is it enough in the long run? I can't tell you. Will there be ongoing needed supports? Probably. So, but this starts a really important conversation, a partnership with the province. They have listened, they have put more money into the space, and we will continue to let them know whether that's enough, whether it's focused right, and where we need to go next, because we're in this together, in my opinion.
This received unanimous support from your city council. How has it been received from the people of London?
Well, you talked about my state of the city off the address, and one of the different things I did with my state of the city is it wasn't a state of the city on job creation or economics or businesses coming to our city. It was about health and homelessness. This is something that I have focused on, that my council is 100% behind, and that everyone in the community in every sector knows it is a significant challenge we need to tackle. So the reception to our work has been one with optimism and hope.
Why is it important to you? We've got like 30 seconds. Why is this important to you?
It's important because these are our people on our streets. This is a need that if we don't provide it, if we don't bring people together, who else will? They're residents, they're citizens, they're people who are friends and families, they're moms, they're brothers and sisters, and they are suffering and they are dying, and we need to take action. So it's important to me because it's people's lives at stake.
Your Worship, thank you so much for coming in all the way from London to our studio. It's been a pleasure speaking to you.
Yeah, my pleasure to be here.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.